Gene therapy uses DNA as a potential way to treat diseases by delivering a correct and functioning copy of a gene. Another approach is to inactivate an improperly functioning gene or to provide an entirely new gene for the purpose of providing whatever the missing function might be. Well, the benefits of gene therapy would be, for one, replacement of what would be considered less patient-friendly approaches in that, for example, an enzyme replacement therapy strategy, that's requiring a lifelong administration of an enzyme every couple of weeks or once a month, something to that effect. So the intention behind gene therapy is that this would be a single administration that would have long-lasting effects and actually address and if not correct, the disease implications rather than just simply treating the symptoms of the disease. There are risks in that this is still a relatively new area of research in human clinical trial. Currently, there are only a handful of approved gene therapies around the world. At this point, none in the United States. However, we do expect that to change in the coming years. So risks with regard to understanding safety and some of the long-term impacts of gene therapy are still being assessed. Some of those might be including triggering the immune system to respond because you're introducing something that's new or potentially foreign. Also, getting targeted therapies, making sure that the gene therapy is going to the right area and doing the right thing. That's something to be considering, as well as the potential for cancer to be caused. And again, these are things that we're working to understand. In the 30 plus years of gene therapy research, a lot has been done to really understand the vectors that are delivering the corrective gene and designing them in such a way that they are very specific for the tissues and the locations therein that they are intended for. And so a lot has gone into understanding the safety profile of some of these viruses, adeno-associated virus in particular. That's one that has been seen in the clinic a number of times and has demonstrated a good safety profile. And commercially, it is also the same virus that is utilized in Unicure's gene therapy that's been approved in Europe called Glybera. The future of gene therapy is exceedingly promising. You will see a number of gene therapy approvals, I believe, in the United States in the next year or two. And the progress that scientists are making with regard to vector design, delivery mechanisms, all of that is all very, very exciting, as well as the information and work that's coming out of clinical trials currently.